Everyone around here could be a camarado, people just looking out for each other. And if you're in a hospital, chances are you're going through a tough time, and that might help.
I think we've lost that connection with just sitting down and talking to complete strangers.
Let's face it, hospital can be a scary place for somebody.
I believe that everybody is a camarado.
It's not every day you see a TP in a hospital. This is a public living room, a place where people can come, no staff, no intervention, no service, no fixing, just a place to be. And what happens is people connect with each other.
So the TP is absolutely ace. It is something that fits beautifully with therapeutic care because it's creating a therapeutic space, which in a busy hospital environment is absolutely essential. I think people come into hospital and they don't appreciate how chaotic it can be, how noisy it can be, so it's an escape from that. But hospitals also, I think, can be quite isolating. So if they come into the TP, they're actually connecting with people and having very normal, everyday conversations that distracts them, takes their mind off what's actually going on.
So we're in the Camerados dome, in the main part of the hospital. Hospitals are really busy, notoriously noisy, and it's difficult to find somewhere that's calm, where nobody's going to come in and do medical things or call names or any of those other things that we hear about in hospitals all the time.
It's a place where you can share experiences with people you've never met before, maybe to support them through difficulties.
It's just giving people to act in difficult situations.
And even if you're in a really terrible place yourself, talking to somebody else and being able to offer help. So there were these two conversations going on, very different set of circumstances, very different set of lives, but both of them ended up talking about bereavement and how grief and dealing with grief had negatively affected their life. And they just had this beautiful moment where two people that probably would have never even been in the same room together had this really touching conversation about how hard grief is and how hard it is when you lose somebody. And it was just a very human moment.
What a camarado actually is, and it's somewhere between a stranger and a friend, and I think that's the whole approach that this is what it's all about. It's about people coming together who wouldn't normally meet in certain situations and just having a chat and maybe confiding in somebody.
It brings people together, and some people I've got no one to talk to, so it helps a lot of people in different ways, to be honest. Because it's not nice, with me being homeless, I know it's like having somebody to talk to, and it does get really lonely, it does.
The TP takes you out of the hospital environment, so it's got nice comfy chairs, bean bags and nice twinkly lights.
That's all clinical, isn't it? It's all sterile and clinical, and then you come in here and it just feels like you're in a completely different place. It doesn't feel like you're in a hospital.
Lovely messages on cards pegged up onto inside there from patients and from staff who've left their reflections of being in that space.
So I kind of agree with people that might look at it and think that's a bit gimmicky, and actually the NHS is there about patient care and providing services to treat people, make people better, diagnose them, make them more comfortable. But I think we're all getting a bit wiser and a bit smarter about the wider determinants of health. It's a bit of a clunky phrase, but it's actually, there's much more to being a well person.
In this situation, in this organisation, this has been fully supported by our senior team, the chief exec. And it's something that they felt was important in terms of staff wellbeing, in terms of patient experience.
I think people think if you're so busy on the ward or so busy in your job, how have you got time to come and sit in a TP? The best thing you can do is take 5 or 10 minutes to just recharge, be mindful, take a bit of time, and then the rest of your day you are going to be more productive. If we had a TP in this hospital permanently, I would 100% think sickness rates would come down. And that in itself would have a massive benefit to the NHS.
Obviously we only need to look at our sickness absence figures month in, month out. Working in HR, we see that all the time, and the costs associated with absence and covering that absence as well. So if we can do something and provide this type of initiative to improve that.
So the creation of this space, the connection that this place inspires is as fundamental as food, water and healthcare and medical treatments.
What people don't understand is that something like this can have a huge impact on a patient. It's not always about pills.
No, it's important for like the mind and the soul and your emotions, which this hospital doesn't have much of. It's all very clinical and white.
I suppose it's having somebody that you can share your experiences with, or talking about it to other people, being more together within it than on your own.